and welcome to this edition of the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith, and today I'm here with Nicole Moffett. Nicole Moffett is a member of our incident management team, and you are the Emergency Preparedness Specialist. What is the scope of that responsibility as it relates to the COVID-19 pandemic?
Yeah, so my main responsibilities, or the bulk of my responsibilities, rest with supporting the incident management team in applying and using the incident management system, that IMS system, to respond to this COVID-19 pandemic.
So what is your background that helps you to bring that knowledge to the table?
Yeah, so I only joined the organization about a year ago, and before that I worked for the AFFES, which is Aviation, Forest Fire, and Emergency Services in the wildfire sector. And we use the incident management system to respond to forest fires. And so I'm familiar with how that organization uses it, as well as other organizations provincially, regionally. It's really the standard when it comes to emergency response.
And it's been really helpful. Your guidance has helped us through a lot of turbulent times. What does a typical day look like for you since the COVID-19 pandemic began?
So despite the fact that there's a lot of unpredictable elements associated with emergencies such as this, there is a rather standard structure that we have every day, and that's what we call the planning cycle. So every day, the same meetings more or less happen. So in the afternoon, the incident management team gets together to talk about what happened throughout the day, and we talk about our upcoming objectives and priorities and establish some timelines. The following day in the morning, we meet to touch base and discuss those actions for the next 24-hour period, which we call the operational cycle. And then from there, we all break out to go action on those items. And so that includes a number of meetings with branches, with sections, and a bunch of fun stuff in between. And then in the afternoon, I usually group up with the planning unit, or the planning section rather. They have a meeting that looks at all of our numbers for the day and projects actions for the future, and then we meet again at 4 o'clock to start it all over.
So how does the incident management system effectively help to manage the situation that we're in now?
Yeah, so the incident management system is a really excellent framework for emergencies, and I could probably go into it for a long time, but I'll try to summarize with a few key points. So it's really a structured response to incident management. It's a standardized approach, which means that it allows a certain amount of interoperability between organizations. So we'll be using the IMS system, but the city may be using the IMS system, the municipal fire agency may be using the system, the province may be using the system. So it really allows us to work together to move forward in responding to the pandemic. It's also really flexible and adaptable to the ever-changing circumstances. It expands or contracts based on what we need it to do. So it really is a great system to apply to this particular emergency.
Did you ever think that you would be applying the incident management system in your experience to a global pandemic?
You know, it had crossed my mind when I first started the job, but I definitely didn't think it would happen, especially in the first year.
So what are some of the biggest or most significant changes that have taken place within the scope of your work?
So that's a great question. I think that one that really stands out to me is, so I alluded to the fact that the system will expand or contract based on our incident needs. So when we first started looking into applying the incident management framework to respond to this emergency, there were just 2 people involved. And so it's been really unique to watch that expand to the level that we have today, which is really quite a complex and a system that has a lot of depth to it. And it'll be interesting moving forward to watch it again begin to contract as we start to resolve and recover.
So what have you learned from this experience? What would you say are your biggest takeaways?
I've learned a lot, and there's been a lot of really positive takeaways from this experience so far. I think something that I'm really looking forward to leveraging is the lessons that we've learned from applying the incident management system to emergencies at our hospital and how we can apply it to future emergencies. So we use the IMS system for Code Orange, for example. So there's a lot of takeaways that we'll have following this pandemic that we'll be able to apply to our preparedness as an organization for other emergency codes and beyond. So I am really grateful for that element.
Well, we're grateful for you. I mean, this isn't the first time that we have applied the incident management system at our hospital, but it's certainly the biggest case of use.
Yes.
Yeah. So what have you been most proud of about our hospital's response to the COVID-19 pandemic?
Well, as you said, this is definitely the most complex case of applying the incident management system. And although there's a lot of people who are familiar with the system before we encountered COVID, there are also a lot of people that were less familiar with it. And it's been really empowering and inspiring to watch everybody get behind a framework that they're perhaps less familiar with. And so, whether it's the leaders that have been directly involved, really educating themselves on how to apply the framework, or if it's people who are a little further outside the system, doing their own hard work to figure out how to leverage it best. It's been really incredible to see everybody come together.
Yeah, I agree.
Yeah.
The amount of collaboration both internally and externally, and applying all that to the incident management system, you already sort of spoke to the fact that it aligns well with what the work of many of our partners.
Yes, exactly. Yeah.
So what is a message you might have for the community at this time?
I feel that everybody may be slowing down and getting a bit tired. It feels like this has been going on for a while, and that's a familiar experience for me in other areas of my career and background. I just think that we're powerful together, and if we keep up the hard work and keep doing what we know we have to do, then we'll come out stronger after all of this is done. So everybody keep up the good work is really the message that I would have.
Fantastic.
Yeah.
Nicole, you keep up the good work. It's been wonderful to have you as part of the team.
I'm glad to be part of it.
I know firsthand that we have benefited greatly from your expertise.
Thank you.
Thanks for joining us today. We'll see you again soon.